The NHS was created officially on the 5th of July 1948. Aneurin Bevan, the health minister responsible for its creation, visited Park Hospital in Manchester. Park Hospital is now Trafford General and is known as the birthplace of the NHS. Bevan met the first NHS patient, a 13-year-old with acute nephritis. The creation of the NHS had huge support amongst members of the public, although it was threatened, perhaps somewhat ironically, by a potential boycott from members of the BMA, the British Medical Association. By the NHS launch day, 94% of the British public had enrolled with the NHS, and it took control of 2,751 of Britain's 3,000 hospitals. Bevan's goals for the NHS were lofty. He made it clear that his vision would see it provide the best care for all, not just be a last resort for those who couldn't afford elsewhere. The NHS would be at the forefront of many discoveries over the next 30 to 40 years, including test tube babies, the discovery of DNA, the use of CT scans, and the introduction of screening for breast cancer. In 1991, with Thatcher in power, the NHS had its first major overhaul with the introduction of the internal market. Health providers would now buy care from hospitals in their area. These providers of care would become the first NHS trusts. In 1997, Blair came to power on the manifesto that claimed that voters had 24 hours to save the NHS from the Conservatives. In 2003, Blair's government would bring in a target that all NHS A&E patients must be treated and discharged or admitted within 4 hours. This target remains, albeit slightly tempered down, to 95%. In 2011, the Health and Social Care Bill was published by the coalition government's health secretary. Some feared that it would mean an end to the NHS as we had become accustomed to it, with David Nicholson, the service's chief executive, saying that the change was so big you could probably see it from space. Many doctors denounced the proposals. The plan was to abolish primary care trusts and create CCGs, clinical commissioning groups. These would be doctor-led, with both consultants and GPs in charge, and nurses also in the leadership frame. It became law in 2012, and its effects began in 2013. Further changes were made in 2013 in light of a public inquiry into events at Mid Staffordshire NHS Foundation Trust, where poor care was found to be the result of staff shortages. Changes were made by the then Health Secretary, Jeremy Hunt, with the goal of reducing mortality and making the NHS the safest healthcare system in the world. In 2015, the Conservatives had the idea of a 7-day NHS, and this was in place by 2020. It means that anyone should be able to visit their GP on any day of the week as well as during the evenings, and that the same quality of hospital care should be provided during the weekend as during the week. The role of the NHS can be best understood by studying its 7 core values. These are working together for patients, respect and dignity, commitment to quality of care, compassion, improving lives, and everyone counts. From these, it can be deduced that the NHS is a public body that works for its patients, respects its patients, and is dedicated to improving their lives. It treats all patients and aims to provide the same high standard of treatment to anyone, irrespective of who they are. To find out more about the structure of the NHS, have a look at our separate guide entitled NHS Structure. When was the NHS founded? Who founded the NHS? Why was the NHS created? How has the NHS changed since its inception? How has the NHS changed since 1990? What do clinical commissioning groups do? Do you think that the NHS is a force for good in the UK, or is there too much emphasis placed on a name and a perhaps outdated organisational system? Would moving to a government insurance model, such as Germany's or Canada's, be a sensible decision for the UK? Make sure that you have a good knowledge of the history of the NHS, especially some of the recent changes that have been made to the way care is paid for and provided. Try to remain neutral when answering questions about the NHS and give a balanced answer that shows the breadth of your understanding rather than a particular opinion.